So, say you're in your table and reading a journal about an observational trial. Suddenly, you come across this term, targeted trial emulation. Now, this is something which is not very commonly heard and not something which we have read in our med schools. So, it's a structured methodological framework where we are using an observational study and trying to make it look like we have done an RCT. Now, this may look like something which is we are trying to adjust, or maybe we are not very hardworking, so we are not doing a RCT rather than trying to collect some observational data and emulate it into RCT. Uh, but we will go in the details today to trying to find out what exactly it is and how we can do it and why it is so important for us in the ICU to know about it. Now, what are the challenges of an observational research? Why do we need this? RCTs aren't always ethical, neither are they feasible or timely. This is very, very important, especially in the context of ICU, when everything is happening so fast. See, for example, a simple thing like an intubation in ICU, if you're planning a trial, it is very difficult to randomize, to send it to the center, then they will tell you which group the patient is in, and you're understanding it's something which you are doing right there. You need to intubate right there immediately. You cannot just waste time in all these research and methodology. So it becomes very ethically challenging to do studies inside the ICU, which are very, very adherent to the rules of RCT. So you will see a lot of pragmatic trials in RCT, but they do the same thing again. They take a lot of leeways with the methodology. So same thing you can do with a conventional observational analysis and then try to use this particular technology. So your conventional observational analysis has structural biases, so which we already know. Now what this targeted trial emulation does is it provides a systematic solution, forcing the researcher to think it like a trial which is a RCT. So we will see how it actually gets done. So it's basically is a two-step process. You articulate it, define a causal question. Mind you, in an observational study, you are exploring something. But here you have given a particular explanation for that observation. So you have a causal question and specify the target trial protocol which needs to be followed. So you, apart from the causal question, you also have something linked with it so that you can explain why that causation has happened. Next is execution. You have to map the protocol inside the observational data and conduct a rigorous analysis, while you also take the trouble to document the assumptions that you have done while making the analysis. I think once we get deeper into this, you will be having a more detailed understanding. So, what is